The condition affects around 200 males here. It can be extremely debilitating as the patient can bleed out as well as bleed internally, which unless diagnosed early can have devastating consequences. Women are affected too as they are the carriers. A patient at the Belfast City Hospital has been telling me how haemophilia has affected his life. Gordon Clarke was diagnosed with haemophilia when he was just 2 years old. A fall when he was a toddler led to a doctor treating a large hematoma on his forehead.
He decided that it was so large that he should lance it and allow the blood to escape. But in fact, once he had lanced it, then I bled and I bled and I bled for a week and was admitted to hospital.
Unfortunately for Gordon, in the 1960s, even the 70s, treatment for this condition was rare.
By the age of 20, most of my joints, especially my weight-bearing joints, were malfunctioning and malformed. That developed later into haemophilic arthropathy, where each of the joints becomes arthritic. And the arthritis then causes further internal bleeding episodes.
Hi, Gordon. Hi there. You're also Benson. So I need some wee bit of treatment for you today.
Gordon lacks a protein called factor 9, which helps his blood to clot. Around 200 males are affected here, but once diagnosed, especially among mothers who are the carriers, and that's the crucial bit, it is treatable.
It's really a pattern of bleeding that you tend to find. It's not just one thing in isolation. So people might have a nosebleed, doesn't give them a bleeding disorder. So this will be a nosebleed that will last for longer than half an hour, bleeding for several days after their teeth are extracted, really minor injuries causing quite significant bleeding that doesn't fit with how they hurt themselves in the first place. And equally for the women who might be carriers of haemophilia, at the time of their period, the bleeding being much more than what you would otherwise expect it to be.
With his charity hat on, Gordon is calling for greater public awareness of the condition, and not just here, but indeed worldwide.
The sad fact is that there are only 30% of the world's haemophilia population who receive adequate care and attention. The remainder are not even on a register.
Gordon Clarke talking to me earlier, and if you think you might be affected, well, you should contact your GP.